So today we are going to be talking about surgical cosmetic gynecology. So it is all the surgical procedures that we can do to enhance the aesthetic outcome of your intimate parts, especially female that we're going to be talking about today. So I am Vidhi Mehta and I am a plastic surgeon based in Mumbai. Just a quick recap of the anatomy that we're going to be dealing with today. So let's begin with the labia majora and the labia minora that we see in our vestibule area. So the majora is covered with normal skin and minora is covered with mucosal tissue. And once you go in the vestibule, which is inside of the minora, and the superior part, we will see clitoris, which is an equivalent of the penis and the female genital area, which is covered with prepuce, which is also known as the clitoral hood, you know. And once we come a little inferior to that, we will see the urethra opening over here, and below that is a vaginal opening. Just inside of the vaginal opening is the hymen ring, which is perforated during the first sexual intercourse, or it can be also be injured during any sexual or other sports activity. The area below this up till the anal canal is known as the perineum. So this is our normal anatomy before we go into the surgical procedures.
Confidence isn't just seen, it's felt. Surgical cosmetic gynecology is transforming women's health and self-confidence. From labiaplasty to vaginal tightening, these procedures restore anatomy, function, and aesthetics. Postpartum changes, aging, or personal concerns. Every woman deserves personalized care, improved comfort, enhanced confidence, and better quality of life.
Now, what do? You can liposuction is the easiest way to get the fat out of this area. Okay. So again, similar indications which are aesthetic and functional. Functionally, because there's a lot of fat pad, you cannot maintain hygiene there. There's a lot of infections because of the droopy fat pad. Because of that, you'll end up with erythema. There can be, candidiasis or bacterial infection, and aesthetically is not looking nice. You cannot wear tight clothes, and it makes you very self-conscious about wearing the sort of clothes that you want to wear. Now, surgically, there are two ways to deal with it. The easiest and the first way is liposuction. So you go in from two very little incisions, which are in the post-operative period hardly ever seen. You go in, do a liposuction, and give a compression bandage. Patients are very, very happy about it. But sometimes when the patients have had a lot of weight loss, there will be skin laxity. So that is not something that is going to be very easy to deal with only with liposuction, because that will only reduce the fat. So when that happens, we also need to trim a little bit of the skin tissue. So we make double two U's on two sides of the Mons, and then they are like a very abdominoplasty incision. They are pulled up, hit, hitched to the abdominal wall and closed. You can see how very tiny little scar is being seen, which is usually hidden in their panty line. So people are not going to be really worried about it. Now we also talk about hymenoplasty. Now hymen ring is just at the anterior end of the vagina. So in this surgery, the size is minimized so as to alter the appearance. Now, when is this needed? It is almost exclusively for a religious and a cultural reason, where virginity at marriage is a culturally mandated idea. Usually in India, we do see a couple of patients who come in for hymenoplasty. Now, what are the expectations? They want an expectation which is that introitus, that is the opening of the vagina, is quite tight, not closed, tight, and we need bleeding at the first intercourse. So, and why do people come in for this? Because when the expectation is not met, they are ostracized from the society. They have some sort of familial consequences or dowry, a lot of other things which follow.
Why are more women choosing cosmetic gynecological surgery? It's not just aesthetics, it's function, comfort, and confidence. Common indications include labial hypertrophy causing discomfort, post-childbirth laxity, dyspareunia, and functional concerns like hygiene issues. Procedures may also address urinary symptoms, scarring, or age-related anatomical changes. Patients often seek improved comfort in daily activities, enhanced sexual well-being, and restored body image. Confidence and quality of life are key drivers, not just appearance. Right indication, right counseling, patient-centered outcomes.